Bismillahirrahmanirrahim. Assalamu alaikum. Hi everyone. Welcome to the channel. Today I would like to talk about history taking a patient presented to you with bleeding per rectum. You will focus on 11 points to take a comprehensive history that will help you in making the differential diagnosis. So, let's begin. First, you will greet the patient, introduce yourself, and take consent for history taking. Then ask about name, age, occupation, and address of patient. Then ask about duration of bleeding per rectum. It will give you clue about acute or chronic condition. In acute cases, it may be due to infections, trauma, etc., while chronic conditions that causes bleeding per rectum include hemorrhoids, anal fissure, inflammatory bowel disease, carcinoma, colon and rectum, etc. Now, move on to the next question. You will ask about color of blood. It may be bright red, which occurs in lower GI bleeding, or dark red, which is usually due to upper GI bleeding. Move on to the next question. You will ask about amount or quantity of blood in stool. It is most important because profuse bleeding per rectum can cause hemodynamic instability, which can prove fatal. Okay. Then you will ask about whether the bleeding is painful or painless. If there is painful bleeding associated with constipation, your top diagnosis, which you will suspect, is anal fissure. However, the top most cause of painless bleeding in old age patient is diverticulosis. Moreover, painless bleeding per rectum in middle age patient can most probably due to hemorrhoids. Let me take you to the next question, which you will ask. You will ask about whether something is coming out of anal canal. If yes and is associated with bleeding, then most probably it is grade 2, 3 or 4 hemorrhoids. Next question. You will ask about whether the blood is mixed with stool or bleeding is separately occurring from stool. Anal fissure will have blood streaks in stool. Bright red blood mixed with stool can be from lower GI tract, while dark stool can be due to upper GI bleeding. Let's move on to the next question. You will ask about history of weight loss. A patient presents with bleeding per rectum associated with weight loss and he or she is elderly, then you should evaluate for lower GI malignancy. Move on to the next question. You will ask about change in bowel habits. If patient presents with chronic history of bleeding per rectum, diarrhea, and abdominal pain, you should think and evaluate for inflammatory bowel disease. Point to be noted. At the end, don't forget to say thank you to the patient. Okay, now it's the time to sum up the whole lecture in 1 minute. First of all, you will greet the patient, introduce yourself and take consent. Then ask about demography of patient. Then ask about duration, color and quantity of blood in stool. Then you will ask whether bleeding is painful or painless. Then ask about whether something coming out of anal canal or not. Then ask about whether blood mixed with stool or separate. Then ask about associated symptoms like weight loss, abdominal pain, constipation and diarrhea, etc. At last, say thank you to patient. This was all about today's session. Thanks for watching and your support.